Hello everyone, and welcome back to my YouTube channel. Eye movement desensitization and reprocessing, EMDR, is a psychotherapy technique that can be helpful for processing and healing traumatic memories. It involves a structured 8-phase approach that helps individuals process distressing memories and reprocess them in a way that reduces their emotional charge. Here's a step-by-step guide on how to use EMDR to heal a traumatic memory. 1. Find a qualified EMDR therapist. It's crucial to work with a trained and licensed EMDR therapist. They will guide you through the process and provide a safe environment for you to explore your traumatic memories. 2. Assessment and history taking. In the first phase, your therapist will take a detailed history to understand your current symptoms, past experiences, and identify specific traumatic memories that need to be targeted. 3. Stabilization and preparation. Before delving into the traumatic memory, your therapist will work with you to develop coping skills, relaxation techniques, and a safe space to manage any emotional distress that may arise during the process. 4. Target identification. You'll work with your therapist to identify a specific traumatic memory or event that you want to process. This should be something that is emotionally charged and still causes distress. 5. Desensitization. During this phase, you'll focus on the traumatic memory while simultaneously engaging in bilateral stimulation. This typically involves following the therapist's hand movements with your eyes, but it can also be achieved through other forms of bilateral stimulation, example, tapping or auditory cues. This phase aims to reduce the emotional intensity of the memory. Sin installation. In this phase, you'll focus on enhancing positive beliefs or adaptive thoughts to replace the negative beliefs associated with the traumatic memory. 7. Body scan. You and your therapist will do a body scan to ensure that any residual tension or physical discomfort related to the memory has been processed. 8. Closure. At the end of each session, your therapist will ensure that you're in a stable state emotionally. They may provide techniques for self-soothing and relaxation. 9. Reevaluation. In subsequent sessions, you'll review the progress and identify if there are any remaining aspects of the memory that need further processing. 10. Integration. Over time, you'll work with your therapist to integrate the insights and changes gained from the EMDR sessions into your daily life. Remember, EMDR can be a powerful tool, but it's important to approach it with patience and self-compassion. It's not uncommon for emotions to surface during the process, but that's a sign that healing is taking place. Always communicate openly with your therapist about your experiences and feelings. Thank you all for being a part of this conversation. Your well-being matters, and you are never alone. Keep taking those steps towards a healthier, happier you. Kindly make sure to subscribe and hit the notification bell so you never miss out on our upcoming videos. Until next time, take care of yourselves.